There's a not-so-obvious clinical condition that can have a variety of effects on the ocular surface, including decreasing successful contact lens wear, decreasing ocular comfort, even for those that are non-contact lens wearers, and decreasing visual quality. Dr. Blackie and Dr. Korb were really the ones to define this not-so-obvious condition. Meibomian gland dysfunction was traditionally thought of as a condition of visibly inflamed lid margins in meibomian glands. Now, taken directly from the paper, the current understanding of meibomian gland dysfunction now includes the polar concept of a less obvious or non-obvious type of hyposecretory obstructive meibomian gland dysfunction, where inflammation and other signs of pathology may be absent unless special examination techniques are employed. A new term, non-obvious obstructive meibomian gland dysfunction, is used to describe what may be the most common form of obstructive meibomian gland dysfunction. If we depend on looking at the lid margin to simply see abnormalities, we will be certain to miss non-obvious meibomian gland dysfunction. Here are two examples of easily visible eyelid margin abnormalities. The one on the left shows an abnormal saponification of the meibomian gland secretions, leading to the abnormal presence of the tear film. The one on the right shows a lid margin where capped meibomian glands are easily visualized. Non-obvious meibomian gland dysfunction is important to identify because if missed and not appropriately addressed, patients may have contact lens comfort issues and ocular comfort issues. Because the lid margins will essentially look normal in this condition, we feel that it's important to assess the lid margin of all patients by applying pressure to the lid margin. On the left, you simply see pressure being placed on the lower lid margin with the examiner's thumb. There are now more controlled ways to provide this pressure to the eyelid margin. The meibomian gland evaluator, as seen on the right, provides a consistent manner to provide appropriate pressure along the lid margins for proper assessment. This will allow you to determine if appropriate oils are being expressed. The absence of meibum or decreased quantities indicate non-obvious meibomian gland dysfunction. Meibomian gland dysfunction was traditionally thought to be easily seen, but non-obvious meibomian gland dysfunction is actually much more common. Remember that just as its name implies, non-obvious meibomian gland dysfunction is difficult to identify unless pressure is placed along the lid margin, even in seemingly normal individuals, to determine if meibum is expressed. Keeping these things in mind will help us appropriately care for our patients and ensure that those with non-obvious meibomian gland dysfunction are identified. We hope that this has been clinically insightful.